Hello, this is Dr. Mark Levandovsky. I'm the founder and medical director of preventive medicine and cancer care located here in Denver, Colorado. And I'd like to share with you some of the common questions that I receive about my practice in concierge medicine in general. The first is, well, what is concierge care and how is it different from traditional medical care that one does? And I would say the main difference for concierge type care approach versus general primary care approach is that the folks who are involved in concierge care have way more in the way of time, rapport, and resources to be able to allocate and spend with their patients. They're not limited by insurance guidelines. They're not mandated by current restrictions institutionally, and they can really delve deeper and spend more time with patients. That's probably the most impressive difference with concierge care and traditional medical care. You just have more face time with the physician and get to spend and form a personal relationship. And that is so tremendously important for care and motivation and change. Now, what further defines and sets our practice apart, preventive medicine and cancer care, compared to other concierge medical practices, is not only the time we spend. So I spend about 3 hours for the initial visit, for the initial intake, to get to know basically who's sitting in front of me head to toe. What is their mental health like? What is their lifestyle like? How did they start their day? What are the stressors? How did they go to sleep? What medical conditions and ailments face them? What are the genetics of their family going back to 3 generations? What is most extensive from what I'm aware of in the practice? Medical testing, biomarker testing, metabolic testing, inflammatory testing, tumor markers, organ function, cardiovascular in-depth panels, individualizing one's risk for most common maladies that plague us in the developing nation, be it cardiovascular disease, be it cancer, be it inflammatory conditions and autoimmune conditions, diabetes and high blood pressure. We really spend the due time and diligence in trying to gather a comprehensive portrait of the person in front of us. In addition to that time, I as an oncologist and a hematologist have just extensive expertise that sets this practice apart from other concierge care practices, that not only can we individualize one's risks of common internal medicine problems, but also what are your risks, your personal risks of the 12 most common cancers that most Americans succumb to if they were to develop the cancer. How to mitigate that risk, what specific steps to take, and both in regards with genetics, genetic testing, early detection, and prevention. So lifestyle, medications, control of other medical conditions. And if one is at risk for one type of cancer, what are the cousin cancers? And how does it play out in the fact? So it's an incredibly complete and extensive portrait from above and beyond what an expertise of a regular internist would be. That is one of the main differences, and part of that process, in addition to the extensive blood work that we've discussed and I've alluded to thus far, as well as my expertise, is the testing that's performed. In the office, we have the incredible capability of looking inside someone's blood vessels and their brain, so we can actually get a sense of what is their vascular and brain age. If you are 40 years old, how old are your vessels? How old is your brain? How robust and fast is it? How adaptable is it? How stressed is it? And then also scan our patient's abdominal cavity and pelvis with an MRI, which does not expose them to radiation and gives us a very meaningful look inside of the organs. Look at the vascular tree and vascular age. And then we have the capability of looking inside the heart, doing echocardiograms and strain testing on the heart. That gives us a much better idea as to how robust and healthy the heart is. So as a result, folks come away with the most comprehensive approach to healthcare, as really it should be, as we call it, healthcare unlimited. That allows you to know what your personalized risks of cardiovascular, cancer, inflammatory conditions are, what to do about it on most integrated fashion, from the from the way you go to bed to the way you wake up, to how you eat, to how and when you exercise, to how you relate to others, to what medicines you take, to what medications, to what medical conditions you deal with. If you have questions, please feel free to reach out to the practice. Be well and be healthy.